19. Okay, what's this? Yeah, these are spitzoid, and evaluating spitzoid melanocytic lesions is challenging because they look atypical, right? They've got large cells, large nuclei, prominent nucleoli, big nests a lot of times. They can have some mitoses. So Spitz nevi can be, if you don't recognize them as a Spitz, they can look like a melanoma at first glance. And remember that originally that's what they were described as by Sophie Spitz as childhood melanoma. Even then, though, recognizing that they had a different behavior than adults, and it was not long later that it was realized that these really are nevi. Of course, we now know that there are atypical forms and melanocytomas and also spitzoid melanomas, and it's complicated way beyond what we have time for. But plump epithelioid to spindled melanocytes, sometimes they involve the epidermis, sometimes the dermis, sometimes both. So you can have junctional, intradermal, or combined, I'm sorry, or compound, excuse me, pattern Spitz nevi. Of course, I want to know some clinical, the age of the patient, what this looks like, all that stuff, okay? But microscopically to me, I'm actually okay with this being a Spitz nevus, unless this is like an old sun damage patient. There's no solar elastosis here, but older patients can get Spitz nevi, but I am much more careful and I am much more demanding in the criteria the older a patient gets. Some people, I don't know if they all, not if everyone agrees with that view, but that's the way I do it. So in any case here, I would say the cells look kind of atypical, but they all look kind of alike. So that's what my mentor, Doug Parker, said. They look funny, but they all look kind of the same sort of funny. They look the same sort of atypia throughout, you know. If you start seeing a lot of pleomorphism, lots of mitoses, atypical mitotic figures, deep mitoses, asymmetry from the left to the right, those are features and there are others and people debate about this, but those are features that get me worried about a spitzoid lesion. And in practice, these are hard, and whenever I see these, I usually show them to my colleagues just to get make sure that we're all in agreement and have consensus about it. Okay, and I kind of wonder with these elongated, almost fascicles, I wonder if this one might be like an ALK positive. There are lots of different types of gene fusions that can be seen in Spitz nevi and different molecular subsets of Spitz that have been described in recent years, right? So Spitz nevus, and in practice, these are a struggle for us sometimes too. This one's particularly inflamed, and there is some dense collagen in the background. As you can sometimes have a lot more than this, and you can have even like desmoplastic kind of change. I don't really like that term because it sounds scary. I like to say sclerotic nevus or sclerotic Spitz nevus personally, but a lot of other smarter people than me say desmoplastic. I just think it sounds scarier than it needs to, but this is a Spitz nevus.